Hello everyone, I am Dr. Pragnya. Welcome to this edition of our Khyal Rakhna series. The current situation is a challenging one and it becomes even more tricky when you or someone you're living with or caring for, including your parents, grandparents, or neighbors, suffer from any chronic conditions like diabetes, asthma, hypertension, cancer, etc. Not only are people with such health conditions at higher risk of developing severe coronavirus infection, but they also need time to time care, especially during this time when it is risky to step out and visit a hospital for a regular checkup. So, today I'll be talking about how to manage chronic conditions during the lockdown. It is a chronic condition characterized by high blood glucose levels. Stock up oral hypoglycemic drugs for at least a month. Store your insulin vials in the refrigerator. Make sure that you have your home glucose monitor and test strips to check your sugar levels when needed. Chart them so you can keep track of any highs and lows in your sugar levels. You can see the recommended ranges on the screen here. Eat your meals on time. Create a meal pattern of eating 3 times a day regularly. Avoid eating in between. Avoid junk food and opt for items with a low glycemic index such as legumes, carrots, and non-starchy vegetables like bean sprouts and salad greens. Talk to your doctor if you have doubts regarding your sugar control or dosages of your medicines. Watch out for symptoms of hypoglycemia as in low blood sugars such as giddiness, confusion, excessive sweating, and fatigue. What you can do at home is immediately consume 3-4 glucose tablets or candies or half a glass of fruit juice or glucose or sugar water. Rush to a hospital if there is no relief. It is a health condition characterized by high BP recordings of more than 140-90 millimeters of mercury. Antihypertensive medicines can be stocked up for a month so you can avoid stepping out. Chart your BP at least once a week or as directed by your physician. Make sure your salt intake is minimum. Avoid direct salt on the table. Check your BP if you have symptoms like headache or fatigue. Speak to your doctor online if you notice any abnormal fluctuations or experience headaches. If you have a high BP recording and associated symptoms of severe headache, chest pain, shortness of breath, then you will need to rush to a hospital immediately. It is a general term used to describe health conditions affecting the heart or blood vessels. Taking medicines regularly is of primal importance, especially if you have undergone a recent bypass surgery. Stock up medicines in advance and remind yourself using timers or apps to make sure you're taking them on time. Most heart ailments are associated with hypertension, so regular checking of BP is important. You are what you eat. Low salt intake, avoiding dairy, fatty products, and maintaining good hydration are vital for heart health. Engage in minimum physical activity like yoga and meditation to reduce stress. If you notice any symptoms not related to heart disease, you should reach out to your doctor or consult online to avoid hospital visits at the moment. Do not self-medicate at any cost. Symptoms like chest pain, sweating, breathing difficulty, fatigue can be indicative of a heart attack, and there must be no delay in rushing to the hospital. Asthma is a respiratory condition that involves inflammation and narrowing of airways due to excessive mucus production. Make sure that you have your inhalers and medicines stocked up. Use an incentive spirometer, also called a lung exerciser, to help you practice deep breathing exercises to build lung capacity. Avoid any triggers that can exaggerate your asthma, allergens, aerosols, cigarette smoking, etc. Practice respiratory exercises regularly to keep your airways clean and improve your lung capacity. Increased shortness of breath, wheezing, difficulty in speaking full sentences, confusion, chest tightness, and bluish lips might be indicative of severe asthma attacks that will need to be treated at a hospital. Cancer is a disease that can cause abnormal cell growth, which is uncontrolled, leading to damage of body tissues and spread from one body part to another. Organize, store, and maintain your cancer treatment medicines. If you have a home care nurse, this will get easier in case of injectables, but necessary precautions have to be taken. If you or somebody in your family knows how to administer IV injections, make sure that the IV sets, saline, etc. are sufficient. Keep names and phone numbers of doctors who are in the cancer care team and are looking after you handy. It is important that you receive help as needed, especially in the meal preparations and moving around inside your house. Pain and anxiety while going through cancer treatment are expected. Speak with your family for emotional or social support. If you're unable to handle the stress, speak to mental health professionals online. If you are facing fatigue, fever, severe pain, swelling at the injection site, uncomfortable side effects of the medicines, you will need to reach out to your doctor and get to a hospital if required. Additionally, you must also reach out to a hospital if you have trouble administering medications yourself. Other than these, the general guidelines you must follow if you need to step out of the house for grocery or medicines are: wear a mask before stepping out of the house. Always carry a hand sanitizer. When outside, maintain at least 2 meters distance from others, irrespective of whether they are sick or not. Avoid coming in contact with high-touch surfaces like doorknobs, staircase handles, etc. Do not touch your face or mask until you're back home. Remove the mask from the back of the head and dispose it in a closed bin and wash your hands after. Only if you can take care of yourself, you can help someone else out. Speak to a doctor online on MFine if you have any doubts or want more guidance in managing your chronic diseases. India, ख्याल रखना.